This is Public Health Impact, and I'm Cham Dallas.
And I'm Phaedra Corso, and this is the first in a series of shows called Public Health Impact, where we bring in a number of public health experts from the College of Public Health who will be talking to us about some important topics that affect our community.
These are the hot button issues in public health, such as aging, disaster management, infectious disease, cancer, obesity. These topics that affect all of us really here in Georgia, in America, and throughout the world.
Well, those sound like some very important topics, Cham, but I suspect that the public has no understanding of what public health actually means, nor do they understand the impact that these important topics have on our community. And I heard that you went out and asked that very question.
I did, and let's go down to the famous arch at the University of Georgia, where I asked some people, what is public health?
Oh my gosh, I have no idea, honestly.
Public health? I don't know. I mean, I know we have a department here at the university for that, and I know that they do a lot of awareness kind of stuff on campus. I don't know what the major entails.
Okay, public health is like, are you talking about public like healthcare, like providing healthcare to the public and like how we do that? Okay, well then I guess that works.
Would that be where you try to decide on what's best for people to stay healthy?
What is public health? I think it's a matter of personal decision, actually, not a matter of socialized medicine. It's a matter of people deciding or either being forced into a better lifestyle. It means riding a bike instead of driving a car. When you get a choice, it means different things like that.
Public health is, I guess, getting the word out and awareness about anything like STDs or cancer, anything like that.
What is public health?
Public health is everyone being able to receive just the basic health care, being able to live happily and healthy, no matter what their social status or their class status. Definitely everyone should be able to have some basic form of health care and not have to just go to the emergency room if they're sick, have a cold, need some antibiotics.
Public health is making sure that everyone is taken care of.
To me, public health is ensuring the mental, physical, and social well-being of the public at large and making sure that everyone is healthy and living to their fullest quality of life.
Well, from those people in the street interviews, we can certainly see there is some confusion about what public health really is. To bring some clarity to this, I'm going to go to Dr. Phil Williams, who's the Dean of the College of Public Health at the University of Georgia. Well, Dean Williams, can you kind of clear this up for us? What is public health?
Well, it can be a confusing term, but it's a very exciting field that affects the lives of every individual on this planet. It's a field that is interdisciplinary. It focuses on preventing diseases and injuries in populations. And so it works at the community level while people are still healthy, not with individuals once they become ill. So it's prevention-based, not treatment-focused, and it deals with populations, not individuals.
Well, what exactly do you mean by interdisciplinary? What fields are involved in this?
Well, the problems we face in public health are too complex for any one single discipline to have all the answers. So it requires a number of disciplines to come together to address the issues. And in public health, there are generally 5 disciplines that are always involved: epidemiology, biostatistics, health policy and management, health promotion and behavior, and environmental health science.
Well, as you know, these 5 fields are how we organize colleges of public health. And due to the work in these 5 fields, the quality of life in the 20th century has dramatically improved. In the United States, for instance, over 30 years longer life can be expected by most people, almost a doubling. But we're going to focus on smoking as a specific topic. How have these 5 fields impacted smoking?
Well, long before science fully understood exactly how cigarette smoking caused cancer. Epidemiologists were able to show that there was a relationship between those who smoked and the occurrence of lung cancer. And they were able to perform these studies with the help of biostatisticians. And once that relationship was identified, that those who smoked had a greater likelihood to develop lung cancer, then health policy and management became involved, and they looked at the cost-benefit in terms of what policies to implement in order to reduce smoking, such as labeling cigarette packages or preventing smoking in public places. And then health promotion and behavior developed programs that would work with those who smoked to try to change their behavior so that they would not smoke, or those who did not smoke not to start smoking. And then the environmental health science, the more laboratory-based focus of our field, did the actual experimentation to determine how much cigarette smoking was required in order to cause lung cancer, or how much the effect was from secondhand cigarette smoke. So it took all 5 areas to address the issue.
Well, thank you, Dean Williams. That's considerably more clarity than we had before. And we're going to focus now on specific subject matter experts here at the University of Georgia College of Public Health and see just how smoking was impacted by the work in these 5 fields of public health. In looking at these 5 fields of public health, we're now going to go to 2 of them, epidemiology and biostatistics. And we're going to go to a subject matter expert here at the University of Georgia College of Public Health, Dr. John Vina, who's head of the Department of Epidemiology and Biostatistics. Well, epidemiology is a big word, John. Why don't you shed some light on what that field really is?
Yes, Cham. Epidemiology is the basic science of all biomedical research. And so it's the study of risk factors, disease determinants in human populations. So all of the research done, the medicines you take, the methods of prevention, all of that is based on epidemiology studies.
I've heard epidemiologists referred to as disease detectives. Why don't you show us how these disease detectives really solved the mystery of what was causing all these health problems from smoking?
Most people think of, again, disease detectives that we just investigate infectious disease outbreaks like flu or foodborne outbreaks. But in fact, epidemiology is used to study chronic disease. And in fact, I've conducted studies of lung cancer, and we have found that there's a clear increase in risk with the number of cigarettes smoked and the number of years that you smoke. And in fact, somebody who's 25 cigarettes a day for 25 years has almost 30 times the risk of developing lung cancer. And in fact, men from 1900 on started picking up the habit. So from 1930 or so onward, the rates really increased in men. And in women, in the 1940s, post-war, developed the habit. You know, you've come a long way, baby. They picked up the smoking habit, and in fact, now lung cancer is the leading cancer killer among women in the United States.
Well, that really is tragic, especially since the disease detectives have informed us that smoking is leading to these cancer outcomes, and now yet it's still going on into the women population as well. Tell us how biostatistics is that partner alongside epidemiology.
Yes, very important member of the team, and in fact, epidemiology and biostatistics are 2 of the leading core disciplines or leading disciplines in public health, and we work with biostatisticians who help us analyze the data. They develop methods to approach the data and study design issues. So biostatistics is a very important, it's statistics applied to biomedical problems.
Well, what about quitting, John? How can we convince everyone that quitting, and show from the data that quitting really is going to help them?
Yes, prevention is very important, and if a smoker quits, in fact, after 15 years, they could go down to the risk of a non-smoker. And there are other preventive efforts as well. High fruit and vegetable intake reduces risk, but the main thing is to quit smoking.
All right, well, that really clarifies that a lot. Thank you, disease detective, for the work that you've done. Now we're going to look at some of the other fields in public health.